Okay, ready to dive in? Today, we're looking at blood tests.
Yeah.
And you know that feeling when you get your results back and almost everything looks normal?
Yep.
Except for one thing.
Yeah.
That's a little bit off.
I know that feeling.
That's what we're tackling today.
Yeah.
Specifically, what happens when you find an isolated, raised alkaline phosphatase level, or ALP, in an otherwise healthy person?
Right.
So no symptoms, no obvious clues.
Okay.
Just that one number that's staring back at you from the page.
Yeah, a bit of a head scratcher.
Don't worry, we've got this. You've sent in some great resources from the Practical GP YouTube channel.
Oh, yeah, I love that channel.
And a couple of medical journals.
Great.
So we're going to break it all down with our expert.
Happy to be here.
Who is amazing at connecting the dots.
Well, I try.
And making sense of the why behind the what's.
That's what I love to do.
So this is a really popular topic, right?
It is, yeah.
It's the most watched video on the Practical GP channel.
I think so.
So clearly a lot of people want to know more about this.
Definitely.
So before we get too far, let's just make sure we're all on the same page.
Sure.
What is alkaline phosphatase?
Right.
And why do doctors care about it?
Well, alkaline phosphatase, or ALP, it's an enzyme found in a lot of different parts of the body.
Okay.
Mainly the liver.
Okay.
And bones. So think of it like a little worker bee that helps with important processes in those tissues. And when we see high ALP levels in a blood test, it's like a signal that something might be going on in the liver or the bones.
So it's not necessarily like a bad thing in and of itself.
No.
It's more like...
It's just a flag.
Yeah.
That we need to look into.
That needs more investigation.
Right.
And that's where things get tricky.
Yeah,
because sometimes a slightly raised ALP can be totally normal, like teenagers.
Yep. They have high ALPs.
Going through growth spurts.
Yeah. Or pregnant women.
Okay.
Or even, you know.
Even just as you get older.
As you get older, yeah.
Okay, that makes sense. But what about when it's not just normal variation?
Right. That's the key question.
A Practical GP video, they use this really interesting case study.
Okay.
There's this 49-year-old woman who went to get blood tests.
Okay.
Because she was feeling a little tired.
Yeah, who isn't?
Who isn't tired these days?
Right.
But her results were, you know, textbook perfect.
Okay.
Except that pesky ALP level.
Oh.
Which was 186.
Okay.
And just so everyone knows, the normal range is about 30 to 130.
Yeah.
So hers was definitely high.
Outside of the normal range, yeah.
So where do you begin to even unravel a mystery like that?
Yeah, well, you know, the first thing is to not jump to conclusions based on that one number.
Yeah.
You need to get the full picture. We need more clues.
More clues, yeah.
So more tests, probably.
So is that always the next step? More tests?
Well, not always, but in this case, yeah. To get a good baseline. The video recommends a full liver panel. Not just the ALP, but other important markers. Like bilirubin and GGT, which is another liver enzyme that can give us more information.
So you want to rule out liver issues before you move on to other possibilities. But wait, isn't ALP also found in bones?
Yeah, good point. You're right.
So wouldn't we want to check that out too?
Absolutely. We can't forget about the bones. So the next logical step is to order some tests that focus on bone health. Like calcium and phosphorus levels, vitamin D, and parathyroid hormone, or PTH. These tests can help us figure out if there's something going on with the bones that might explain the high ALP.
So we're basically looking at both the liver and bones as potential culprits.
A two-pronged investigation.
Two-pronged investigation. I like that.
Yeah.
And they also suggest checking kidney and thyroid function.
Yep. Good idea.
And a complete blood count.
Yeah, to be thorough.
So it's like a
full body scan.
Full body scan.
Exactly.
Make sure nothing else is hiding in the shadows.
Yeah, you want to rule out any other obvious problems.
Okay, so let's say all of these additional tests come back perfectly normal. Does that mean we can just, you know, breathe a sigh of relief, tell the patient everything's fine, case closed?
Not so fast. It doesn't necessarily mean there's nothing wrong. It just might mean we can wait and see. For a bit. The video suggests rechecking the ALP levels after 3 months. Unless something else pops up.
So it's not always a rush to a diagnosis.
Not always, no. It can be a wait and see approach sometimes. And then they kind of do this choose your own adventure thing.
I love that.
Based on the results. So what happens if that GGT level we talked about is also high?
Okay. Yeah. What happens then?
Well, if both ALP and GGT are high,
yeah,
it suggests the issue's probably coming from the liver.
Okay, so that's when you might refer them to a specialist for more in-depth liver testing.
Not necessarily right away. Okay. You'd want to do some imaging of the liver first.
Okay.
Usually an abdominal ultrasound. To look for any structural problems or signs of an issue. And depending on the patient and their history, you might consider testing for antimitochondrial antibodies.
Okay, hold on. What is antimitochondrial antibodies?
It's a mouthful, isn't it?
And why does that matter in this context?
Well, it could point to a condition called primary biliary cirrhosis.
Okay, so what is that?
Primary biliary cirrhosis. It's a chronic liver disease where the body's immune system attacks the bile ducts in the liver. Which causes inflammation and damage. And this can lead to a buildup of bile, which spills into the bloodstream. And that causes high ALP levels.
So it's like the body's attacking itself.
Yeah, exactly.
And ALP is like a side effect, yeah.
Okay.
It's one of those autoimmune conditions where the immune system goes a bit haywire.
Yeah.
Starts attacking healthy tissues.
Right, okay.
Let's go.
So that's one possible pathway. If the GGT is high, what if the GGT is normal?
Okay, well then...
Does that mean we rule out the liver and move on to the bones?
Pretty much, yeah.
Okay.
If GGT is normal, then the focus really shifts to the bones.
Okay.
And remember those vitamin D and PTH levels we talked about?
Yes.
This is where they come in.
Okay.
Vitamin D deficiency, for example, is a pretty common cause of high ALP.
Okay.
And something we can easily fix with supplements.
Other possibilities could be Paget's disease of bone. Which affects bone growth. And certain types of bone tumors. Although those are less common.
Okay, so it seems like these initial tests are really like a roadmap.
Yeah, a roadmap is a good way to put it.
Guiding us towards the most likely cause. And helping us decide what to do next.
Exactly.
But there's more to it than that, right?
Yeah, there's a little more.
The video mentioned something called the 1.5x rule.
Right.
Which sounds kind of cryptic. Can you decode that for us?
Yeah, so the 1.5x rule, it's basically a guideline to help us decide if we need to investigate more right away or if we can just watch and wait. So it means that if the ALP level is less than 1.5 times the upper limit of normal, and there are no other red flags from those tests, then monitoring might be the best approach. But if it's more than 1.5 times the upper limit, then further investigation is usually needed.
Even if everything else looks okay?
Yeah, even if everything else looks fine.
So it's like a threshold.
Yeah.
For when to worry and when to just kind of keep an eye on things.
Yep.
Makes sense.
Just a guideline, though. Every patient is different.
Right. Okay.
Clinical judgment always plays a role.
Okay, so let's go back to our 49-year-old patient from the video.
Okay.
What ended up happening with her?
Well, her case took a bit of an unexpected turn. Her repeat tests showed that her GGT, vitamin D, and PTH were normal. Which is good news.
It's hot news.
But her ALP had gone up even more.
Oh, no.
And then she started getting some abdominal discomfort.
Oh, that's not good.
Yeah.
Did they have to, like, rush her to the hospital or something?
Not quite.
Okay.
But her doctor decided to order an abdominal ultrasound. To be safe. Right. And that's when they found the cause of her high ALP. Steatosis or fatty liver.
Wow, so she had fatty liver disease this whole time.
It seems so.
And that was causing the raised ALP.
Looks like it.
But her other liver tests were normal.
Right.
How is that possible?
Well, it highlights how tricky this can be.
Yeah.
Fatty liver disease, especially early on, can cause high ALP even when other liver enzymes are normal.
Wow.
It's thought to be related to inflammation. And damage to the bile ducts in the liver. Even if the damage isn't severe enough to show up in other tests.
Okay, that's fascinating.
It's interesting.
And, you know, you mentioned that the Practical GP channel has some great resources on fatty liver disease.
They do.
You know, our listener was smart enough to include those in their request.
Very good.
So we'll definitely have to explore that more in another episode.
Looking forward to it.
But before we go down that rabbit hole, let's bring it back to isolated raised ALP.
Okay.
What are some key takeaways that we want to make sure our listener remembers?
The The most important message here is that a systematic approach is key.
Okay.
We need to consider both liver and bone-related causes.
Right.
And use a combination of blood tests, imaging, and clinical judgment to guide us.
Okay.
And sometimes watchful waiting is the best approach, especially when the ALP elevation is mild and other tests are normal.
Makes sense.
It's all about finding that sweet spot between being thorough and not jumping the gun on procedures or treatments.
I love how you put that.
Thanks.
It's about being a thoughtful detective, not blindly following a protocol.
Exactly.
But, you know, I feel like there's even more to this story.
Oh, there's always more.
Like, what about those less obvious factors that might influence ALP levels?
Yeah, you're thinking like a true detective. We've only just scratched the surface. Things like a person's age, sex, medical history, certain medication.
All of that can come into play.
Right.
And that's a perfect segue to part 2 of our deep dive.
Yes.
We'll unpack some of those less obvious factors.
I can't wait.
And explore some of the trickier scenarios.
Sounds intriguing.
That can pop up
when
we're trying to solve this ALP puzzle.
Stay tuned.
Stay tuned.